everybody, it's Thom Lafferty here, your Chief Executive. Now today is a very special day in the history of Princess Alexandra Hospital, and that's because this is the day we launch our brand new organisational strategy. It's called RISE, and it's called RISE for a very specific purpose. We wanted to put together a piece of work that showed that we are on a journey. We're on an upward trajectory to improve. We know we've got a lot of room to go with regard to that improvement, whether it's the working conditions the staff experience, the clinical conditions the patient experience. We know we need to keep on improving, but we are starting to see green shoots of that improvement. But we can't stop with those green shoots. We must continue to rise. We must continue to get better. And in three key areas, we are looking to rise. The first is rising hope. We want our members of staff, our volunteers, and everyone we work with to be able to see the light at the end of the tunnel. We know that working in the NHS is difficult. We know that across the NHS, and including in PAH, in some areas morale is low, and so therefore we want to give people inspiration. We want to give people opportunity so that they can hope for bigger and better things in future, for themselves, but also for the patients. We also want to rise for our communities. You will know that in Harlow specifically, and also some of the other areas that we serve here in West Essex, our towns are going through massive regeneration. We want to work as part of that regeneration to connect directly to our communities, whether that means connecting directly to members of the public to try and support the prevention agenda, or indeed working with our stakeholder partners like GPs, like mental health and community services. We know that part of our strategic plans have to be based in terms of how we work better and more closely with patients themselves, but also other providers of health and care in our patch. And then thirdly, it's about rising standards. Rising standards is recognising that for a population of the size that we serve, we will always need to have high quality acute services that patients can rely on both with regard to quality, but also with regard to timely access to care. So those are the three things that we're basing our strategy around. What's really important is that this is not a strategy that just sits on a shelf, in a glossy manual with some nice words. This needs to be couched in terms of real clinical and operational specifics. So over the last few months, to get to this point, we've engaged with every single clinical specialty across our organisation to try and get a specialty-specific view on what we need to do with every one of our services to make it really fly in future, to make it really rise, whether that be rising for staff, rising with regard to connection to the community, or rising with regard to our acute and more specialist ambitions. I'm really excited about the fact that it doesn't matter whether you work in cardiology or neurology or respiratory, you will have a local interpretation of what RISE means to you, which hopefully we can all connect on as part of this joint endeavour to make things better for our staff and better for our patients. So as you can see, I'm tremendously excited. I hope you are too, and it's onwards and upwards for our organisation.